you know, we have we just announced that we have a case here in the county, from an individual who traveled, coronavirus, from an individual who traveled, on a cruise recently from San Francisco to Mexico. And we're here to provide some availability and answer your questions you may have. And before we get started, I just want to introduce who we all have here today. We have, Sonoma County, Chair of the Board, Susan Gorin. We have with us, County Health Officer, Dr. Celeste Phillip. We have with us Director of Health Services, Barbie Robinson, and Department of Emergency Management Director, Chris Godfrey. And, and a representative from Sonoma County Office of Education.
Jenny Snyder.
Jenny Snyder.
Deputy Superintendent.
Thank you. All right, with that, we can start, we'll take the first question.
I'd like to ask about the school, the Hillsborough School. Can you comment about that?
Direct that to
Who should I?
Ms. Snyder.
You want to start?
Who's that with?
So I can share what I know. So as you know, this is a rapidly evolving situation. I think in every community that's experiencing information that as soon as we are made aware, we have to start making decisions. So we found out yesterday that we had a patient that had a positive result. And once that occurs, there's a set of steps that are set into motion, and that includes trying to understand if there were any exposures to healthcare workers, other community members that may have occurred before we knew of the diagnosis. And so that is indeed what happened in this case. So it was through that process of backtracking, understanding when this individual began having symptoms and therefore may have been infectious to others, that we identified that someone involved with the care of this patient had a presence at the school in Hillsborough. And there was a decision made last night to close the school because there was not an opportunity, because it was after hours, to have a conversation about what would be most appropriate for that school to minimize impacts and exposures to students and faculty. So that was a decision that was made by school leadership. Since that time, we've had an opportunity to discuss what would be most appropriate, and they are working on doing a environmental cleaning of the property, and are planning to reopen tomorrow if everything goes smoothly. So that's what I can share.
Could you spell your name and your title again? I'm sorry.
Celeste, Celeste, last name is Philip. I'm the health officer for Sonoma County.
Can you give us specific
Just to
details?
clarify, maybe this goes to you. So there was the exposure, if there was limited, why would the school have been closed if there was exposure to somebody on the outside of the coronavirus?
So the individual involved with the care of this particular patient was at the school during the period where the patient had symptoms, but we had not conducted testing. So out of an abundance of caution, the decision was made to not open school until we could talk with school leadership about the next appropriate steps to make sure they minimize exposure to students and staff.
So if you
was
don't
it a
know if there was
patient?
exposure, I mean, could have someone picked up the virus from this individual?
All of the healthcare workers that we are currently monitoring are asymptomatic, but as you probably heard over and over, there is a 14-day window where we look for symptoms to develop. So we are in that window. If something changes, we will have to then go back and look at exposures for that person, if that person then becomes someone who's positive with COVID-19. So that's why I said this is a very fluid process, and as we are identifying individuals who are infected, having to look at the contacts they've had, monitor those individuals. If any of those individuals become cases themselves, that's a whole nother process of understanding what exposures they may have had during the incubation period. That's the time from when they have been exposed until developing symptoms.
But even if there's a
Excuse me, there are
possibility,
other questions here.
Sorry.
What's the name of the cruise ship that this person was flying?
We do not have the name of the cruise ship yet.
And why is that?
I'm sorry?
Why don't we know the name of the
We're
cruise?
working with the state and the CDC to identify which cruise ship it was.
How about the emergency declaration? What does that allow you to do that you weren't able to do before you called it? And why was it declared?
From a public health perspective, we have been watching this very closely, and every day we've seen that there are new cases that are being found. Initially, it was in a very measured manner for travelers returning that were being quarantined. We were expecting that we might start to see cases that arose in the community, and once that shift started occurring, there have been a lot of discussions locally, at the state level and nationally, about the implications. In our particular case, once we identified that we had this individual who may have had exposure on a cruise, which, as we all know, is a very large investigation that would occur afterwards, the declaration allows for us to have better coordination within the different county agencies, as well as then being able to access mutual aid and assistance in a more streamlined process. Also being able to shift the way we prioritize our work so that we can spend more time on this effort and possibly bringing in additional staff from other parts of the departments to assist us.
But the declaration of emergency also allows the county and the county personnel to gear up into and partially operate the Emergency Operations Center. I think you're all familiar with that. Having been through 2 fires and a flood recently, we are ready and prepared for any emergency that would require all of the departments or some of the departments to gather and work with all of our cities, in this case our schools and other sectors of the economy, to really understand the threat of the emergency and the emergence of what is happening right now, to really work on communication county-wide with our residents and all of our partners. I think it's an appropriate action, although we are declaring this declaration of emergency today. We will be having a special board meeting on Wednesday at 4 o'clock in this chambers, where all of the supervisors will be here to ratify the declaration. And I believe on March 10th in the afternoon, we are scheduling a special part of that regular board meeting to talk about the outbreak of the virus and what the county is doing to coordinate and communicate with our community about that. Chris Godley, our emergency manager, emergency operations manager, you might comment on.
Can you spell your name?
Yeah, first and last name and say it too.
Yes, it's Susan, S-U-S-A-N, Gorin, G-O-R-I-N.
In your title.
And I'm chair of the board of supervisors.
Thank you.
Good afternoon, I'm Christopher Godley, that's C-H-R-I-S-T-O-P-H-E-R G-O-D-L-E-Y. I'm the Director of Emergency Management for Sonoma County. Follow on to the supervisor's points, by proclaiming a local emergency, it does not only help the county get the word out that this is an event worthy of the community's attention, it also allows the county to marshal its resources, focus energies and efforts, reassign staff, and ensure that we're in a proper and well-positioned place to deal with whatever comes. In addition to dealing with the immediate consequences of the infection here in Sonoma County, our job is to anticipate potential even larger impacts that we may have to address. And so to that end, a large part of this emergency proclamation is to position ourselves for what might come in the future.
Can I ask a question? So someone involved with the care of a patient was at the school. When they were at the school, were the kids at the school?
I don't know specifics regarding the event. I can just tell you it was an event in the evening. It was not during school hours.
Okay.
Jenny Snyder, Jenniesnyder, Deputy Superintendent, Sonoma County Office of Education. And we are just encouraging schools to take precautions in this time, keep kids safe. We take our direction from the County Department of Health, who would make the decision to close any school within the county. So at this time, all of the public schools are open, and we anticipate them to be open until we receive a notice or update otherwise.
I have heard that the coronavirus can exist on surfaces for 9 days. So how confident are you, there's no question that there's not gonna be any on any surface at that school?
First of all, this event occurred at a private school, and private schools do not report to the Sonoma County Office of Education. They're a private entity, so I'm not really sure what measures they have in place regarding cleaning of surfaces and so forth. But in public schools, we're encouraging schools and districts to ensure cleaning procedures and hygiene of facilities and those kinds of things.
You're allowing a school by school basis as to the cleaning protocol?
Districts have their own cleaning protocols, and their guidelines around cleaning surfaces and making sure that those facilities are clean.
Wouldn't it be a Department of Health issue, as far as this particular?
Sure, I mean, in terms of guidelines, regarding cleaning and best practices and those kinds of things, that information is being shared with, districts throughout the county.
And is the school following, I mean, is it supervised to make sure they're doing this?
There
By the
are
book.
facilities, staff, maintenance staff that supervise, and so I can't,
Dr. Phillip, a quick question for you, if I might, concerning working with hospitals and healthcare providers in the community. Has your relationship changed in response to the emergency? Are you working more closely? Are new protocols going into effect for doctors in the county dealing with, first responding and people coming in?
We have an existing healthcare coalition that's made up of all hospitals, large clinics, and other healthcare providers, and we've used that forum as a way of addressing any number of emerging issues in Sonoma County in the past year in particular. So that is a good starting point for us to have conversations around what does each new guideline mean. As data is shared, we've been having weekly calls. We also are having a call for clinicians this afternoon to talk about the updated guidelines and the implications for testing. And we expect that will also be a weekly call so that we can have direct conversations with the healthcare providers in our community.
Last week you reported that we didn't have any test kits here in Sonoma County. Do we have those yet?
We are still awaiting the arrival of test kits to the public health lab in our county. We are hoping that they'll arrive by the end of this week.
And aside from the cases that have tested positive, and those tests have been sent out of the county to confirm, how many people potentially have been exposed across the county?
If I knew the answer to that, I think
But we have some idea of how many people were sort of surveyed, in terms of surveillance, in terms of people that we're talking to. How big is that population of potential exposure?
So I think there are a couple of pieces to your question. We can look at specific exposures based on individuals as they become identified as a case because they've tested positive. But when we look more broadly, we see that there is likely community transmission that is occurring in different parts of our state, different parts of our country. And that's the really difficult question, because until we have better testing, it will be harder for us to know how many people have been exposed. And there are very sophisticated ways of looking at how long that exposure may have occurred. So those are some of the steps that we'll be looking to in the future. For right now, we want everyone to remain vigilant with the personal steps that you can take. Wash your hands frequently. This is still flu season, so if you're coughing or sneezing for any reason, to make sure you stay home from work and school. It's not too late to get your flu shot, so we are still reminding people of those things that they can do.
A quick question.
And I would just add, anybody who is running a fever and is experiencing coughing, please seek the care of a medical professional. I think early detection, whether it's flu or whether it's potential exposure to coronavirus, you should treat it very seriously.
A question for part of the audience. We're told that you made the call on why we're not releasing the names of the hospitals that are currently caring for patients who either have tested positive or are potential cases.
We can get you the specific information, but we believe that the HIPAA laws prevent us from sharing that information. Given the number of hospitals in the county. Given the current trend, there is the potential that every hospital in the county could, in fact, see patients. And I encourage you to reach out to hospitals if you want that information. We do not believe that we have the authority. The relationship is between the hospital and the patient, and we do not want to
But we don't want the
breach
names of the patient, we just wanna know which hospitals are caring for them.
I would also add that other counties have released the names of hospitals that patients are being treated at.
Right,
The
I
governor
can't speak,
last week
I can't speak for what other jurisdictions, have decided to do with respect to divulging that information. It is our, opinion that, the liability, and the risk, we want to protect the, patients, and their privacy, and so we are at this juncture not releasing that information.
Then do you believe that other counties are violating the laws?
I can't speak to what other counties, are doing. We've made a decision here in Sonoma County that, for the privacy of patients, we do not want to release that information.
Can you cite the HIPAA citation?
We can provide you with the, specific citations.
Could you give us your name, title, and spelling?
Yes, Barbie Robinson, BARBIE, ROBINSON, Director of Health Services for Sonoma.
The test kits, when they arrive, will they be coming from the state or CDC, and what capability locally will that provide you that you don't have now? Because I know some are being sent to Richmond, if I'm not mistaken.
That is correct. Once we have the test kit, we can do the initial testing in our county. As you may be aware, if we test outside of CDC and we have a positive test, it's considered a presumptive positive, meaning that the CDC lab has to do a second round to confirm that testing.
And you've done that first one?
We do not have the test kits yet in our county,
So the state does the first round?
currently, yes,
On that?
yes.
Would you describe the public health department's, sort of campaign here as one of mitigation or one of, containment at this point?
I would say we are at that point where we are starting to shift from primarily containment into mitigation. Once you start seeing that there are cases in many different communities and also understanding, that, when we look at what happened in Wuhan, where the initial number of cases were based strictly on lab tested and confirmed individuals that were positive, and then the shift to say we're now looking at individuals that had clinical symptoms consistent with the disease, that paints a very different picture in terms of the overall number. And when you think about when some of the travel restrictions came into place and what we are seeing, I think there is more evidence to suggest that their community spread is likely occurring, even though we don't know for sure yet. We have to take that information and start shifting our approach. And part of that includes working very closely with hospital providers to talk about when we should test, and also thinking about all of the protective measures that we can take in general for patients that may have respiratory symptoms, such as placing a surgical mask on a patient as soon as you are aware that there might be a respiratory infection involved, to prevent spread to others. So some of those shifts that we can take, some of those steps that we can take to be a bit more proactive, I think we're in a place to talk about that. And since we're talking about masks, want to emphasize the U.S. Surgeon General's comments about preserving masks for healthcare workers as much as possible. If you are ill, it is appropriate and recommended that you wear a surgical mask. If you are well, there is no evidence that there's any benefit. And when we are, as a community, looking at how we are most responsive and how we best can be protective and strategic, we want to reserve those masks for when they are appropriate.
Have any hospital staff been tested for coronavirus? And have any of those tests resulted positive?
We are not at a point, excuse me, we are not at a point in our investigation yet where we have tested any healthcare workers.
Can you give us a name, a gender, age of the person who was at that school?
Excuse me, I don't have specific demographics on, I just know it was an adult.
Is the presumptive patient now positive for the coronavirus?
We have not received the follow-up testing from CDC yet, so technically it's still a presumptive positive.
Do we know how many people are in self-quarantine in the county? How many are? We've heard that some staff have been asked to take furlough, to go home.
Yes, we are still in the middle of working very closely with the infection control staff at the hospitals. I do not have specific numbers.
And how many people are in self-quarantine?
Is there a way to distinguish the seasonal flu from the coronavirus?
Yes, they are different viruses, so there's very good specific testing for influenza A and B. And we are encouraging that providers test all individuals that they are concerned may have influenza for flu, because we are still seeing a number of cases.
Are there any, do we know what's happening at the airport? Are there any new protocols there for screening? We asked the airport and they deferred to the public health on that question.
I know that there's discussion about some changes that might occur, but I would defer to CDC and CDPH. That's not a local decision.
But the Sonoma County employee. Anything?
I think you'd have to reach out to the airport. We have not done anything with them directly.
Any other questions?
Just wanted to share, there's 2 confirmed cases in this county.
Yes, the first case was an individual that was transferred from Travis Air Force Base. That person is not a resident of the county, but is in one of our hospitals. And then the case that we announced today is a Sonoma County resident and is a presumptive positive.
Is there really anything else that people should be doing at this point besides the general hygiene routine? Washing your hands, covering your mouth, is there anything else people should really be aware of, they need to do?
I would say most of us can always do a better job at many of those recommendations. I think we will find ourselves at a point in the near future where you might reconsider some of your travel plans. That's not being recommended now, but that is, I know that there are students that have been recalled from different universities that are in countries that have been added to the list, for example. So I think if we can do our best to be proactive, those impacts will be limited. But if not, we might expect that there will be changes regarding congregate settings, large events that we can expect. Maybe something that we have to consider in the future.
If there are no other questions, I'd just like to thank you all so much for being here this afternoon. I think the message is that we at the county are working very carefully with our community partners and within each of our departments to activate our emergency operations center to make sure that we are coordinated, communicating, and taking the appropriate actions in an abundance of caution. And we want everybody to treat this health threat very seriously in practicing personal hygiene, washing hands, avoiding crowds, staying at home, and particularly if you have symptoms of the flu or the virus, and recognizing, and I want to thank you all for communicating all of these messages. There is not a news media that I'm picking up that does not have the precautions and the hand washing and the recommendations on avoiding some crowded situations potentially, and resisting the effort or resisting your interest in going out into the community. If you exhibit these symptoms, you don't want to infect anybody else, whether it's the flu or cold or the coronavirus. So thank you so much.